But now that is just not the case, and the technology is growing by leaps and bounds. In today's On Your Side Health Report, a local woman knows firsthand what it's like to face knee replacement surgery in the prime of her life. Sherry Schumacher is in a lot of pain. But this is nothing compared to what she used to go through.
I love life. Life to me is something very precious, and I almost wish that I wasn't alive because every step hurt. And I was actually dragging my leg.
After 2 unsuccessful orthoscopic surgeries, this vibrant 41-year-old business owner and mother of 5 had no choice but to have a knee replacement. And if 41 sounds too young to you, doctors say joint replacement isn't an elderly health issue anymore. Between old sports injuries and family history, more and more baby boomers are having replacement surgery earlier, especially because technology is allowing doctors to do a less invasive type of surgery.
We're not cutting out a big chunk of bone and putting in a gear works. It's more like putting a cap on your tooth. We're removing the rough surface or the diseased surface of the joint and slipping a smooth cap over the end of that surface.
And 6 weeks ago, that is exactly what Dr. Kepler did to Sherry. He replaced destroyed joints and tissue in her right knee. Here's what Sherry's knee looked like before the surgery.
There's very narrow joint space, if any, as compared to the healthy side, where you can see a nice smooth bony surface and a nice gap between the bones.
Now take a look at what Sherry's knee looks like after surgery. This metal tray was put over her shin bone. A metal cap goes over the end of her thigh bone, and right in between is the plastic material that acts like natural cartilage.
It allows the joint not only to flex and extend, but also to rotate.
It's just amazing. If you have knee problems yourself, you will be glad to know there are a lot more advances like that one on the horizon. Doctors can now transplant healthy cartilage from other joints into the bad joints. And as we showed you just a couple of weeks ago, a local doctor is overseeing a study where brand new cartilage is actually being grown in the lab.
Wow.
These